Hi everyone, in this video we will be explaining the histogel cell block method, a simple technique used in cytology laboratories to convert liquid samples into solid blocks for better microscopic examination. Firstly, what is histogel cell block method? It is a cytology preparation technique in which concentrated cellular materials is embedded in an agarose-based gel matrix known as histogel, and then the solidified gel containing cells is processed and embedded in paraffin, producing sections that can be examined like routine histology specimens. Next, moving on to the role of histogel cell block in diagnostic cytopathology. When and why do we use histogel? We use for cytology specimens with a predominance of individually scattered cells. Why? Because in histogel, it involves steps to concentrate the cells of interest along the plane parallel to the cutting surface of the cell block. For example, it can be used for cell block preparation of cervical thin preps, which are usually less cellular and may contain only scattered individual abnormal cells. Next, I will explain on the principle of histogel cell block method. For your information, histogel is a hydroxyethyl agarose-based gel that solidifies at room temperature and liquefies when heated at 60 to 65 degrees Celsius. By using histogel, cells are trapped and supported within the gel matrix, preventing cell loss and maintaining cellular integrity. Then, the gel solidifies, allowing the sample to be processed like the routine histology tissue, enabling multiple sections and further testing.
Assalamualaikum. My name is Assalamualaikum. My name is Nu'aim Fahana and I will present about the type of specimen. The first one is fine needle aspiration FNAC, where cell can be easily lost during processing. The next one is urine specimen, where many urine specimen are hypocellular. The next one is non-gynae specimen, which have variable cellularity, and the last one is tissue aggregate, which are risk of loss during processing. Next, we go to the material needed in the histogel. The first one is histogel, which is as embedding gel. It is solid at room temperature, and when warm or heated, it turns into liquid. The next one is centrifuge tube, where we use to concentrate cell from fluid specimen. Next is tissue cassette, where it holds solidified histogel. Next one is applicator stick, where we use to mix, position, and transfer solidified histogel from tube to cassette. And the last one is formalin, where we use to fix the histogel block to ensure long-term preservation and also good staining quality.
I'll be presenting on the procedure of this histogel cell block method. As being mentioned earlier, we use commercially prepared histogel which present in the form of semi-solid in room temperature. The first step is the histogel must be liquefied. This is done by heating it to 60 degrees Celsius either in a boiling water bath for 3 to 10 minutes or by microwave for 5 to 15 seconds. Once liquefied, the histogel is kept in the dry bath about 50 degrees Celsius to maintain it in liquid form until use. Next, the second step, which is preparing the cell pellet. The specimen is centrifuged for 5 to 10 minutes at 2400 to 2500 rpm to concentrate the cells into a pellet. After centrifugation, the supernatant is carefully decanted, leaving a compact cell pellet at the bottom of the tube. Then, the third step. 1 to 6 drops of liquefied histogel are pipetted onto the cell pellet, depending on the size of the pellet. The tube is gently vortexed for a few seconds to ensure the cells are evenly mixed with the histogel. After mixing, the sample is allowed to cool to near room temperature so that the histogel can solidify. This can occur naturally or be accelerated by placing on ice or freezer. The fourth step, once the gel has solidified, the gel cell pellet is carefully removed from the tube using an applicator stick or spatula and placed into a tissue cassette. Finally, the cassette is submerged in 10% buffered formalin for fixation and then processed using routine histology procedures. This allows the cell block to be sectioned and stained for microscopic examination.
Assalamualaikum and hello everyone. My name is Nur Avni and I will continue on the explanation of advantages of the histogel cell block method in cytology, particularly in FNAC sample. First, histogel improves the preservation of cellular architecture, unlike the conventional FNAC smears, where cells are spread on a slide. Histogel provides a supportive gel matrix that holds the cells together. This holds the sample to retain tissue-like architecture, making it easier to see the important structural patterns such as clusters, glands, or cell arrangement that may be poorly appreciated in routine smear. This greatly helps in improving morphological interpretation. Next, histogel reduces the cell loss. In many traditional methods, cells can be lost during the sample processing. However, histogel traps the cell inside a cohesive gel, preventing fragmentation and uneven distribution. This means more cells are preserved throughout the processing and suctioning, which improve the diagnostic yield, especially when the specimen is small. Another major advantage is it enhances the utility for ancillary studies. Histogel cell block method can produce multiple serial sections, which are suitable for immunohistochemistry, special stains, and molecular testing. This is very important in FNAC samples where material is limited but additional tests are needed for accurate diagnosis, genotyping, or prognostic marker evaluation. Next, histogel also provides a better cutting plane visibility during the sectioning. Because the gel creates a uniform and consistent block, histo technologists can easily locate the plane where cells are most concentrated. This reduces the risk of missing diagnostic areas during the microtomy and ensures that the most informative part of the cell is examined. In addition, histogel is compatible with routine histopathology processing. Cell blocks prepared with histogel can be processed just like the formalin fixed paraffin embedded tissue. This means it integrates smoothly into the standard laboratory workflow without the need for special equipment or major protocol changes. It also provides a diagnostic boost. Study shows that the cell block can increase the diagnostic accuracy by about 6.5 to 9% compared to smear evaluation alone, because the cell block provides a mini biopsy-like histological details. Furthermore, the method is reproducible and easy to standardize. It is simple and standardized preparation steps reduce the operator-dependent variation, resulting in more consistent cell block quality across different labs. Finally, histogel offers the operational efficiency and long-term stability because this method is quite straightforward and does not require any specialized preparation. Once embedded in paraffin, the cell block can be stored at a room temperature for many years, allowing for future review or additional testing if needed.
Now, for the limitation of the histogel method. First and foremost, inconsistent and low cellularity. Histogel has been shown to produce highly inconsistent cellularity, especially in low volume or scan samples that lack visible tissue fragments. This inconsistency can limit its usefulness in low cellular fluids. Studies comparing histogel with alternative methods such as plasma thrombin, cell gel, and excellent indicate that histogel often yields fewer cells. For example, excellent cell blocks were significantly more cellular and preserves better cytomorphology than histogel. Similarly, collodion-backed methods maintain good cellular yield even in low-volume samples. Another limitation is the distortion of cellular morphology. In samples with sparse cellularity, histogel cell blocks can exhibit artifacts. This may compromise the detail and cellular morphology, which is important for accurate cytological interpretation. Comparative studies suggest that methods like excellent consistently preserve cellular detail better, especially in formalin processed specimen. Next, histogel requires longer preparation and processing time. Standard histogel protocols take approximately 30 minutes per batch, and modified protocols can extend up to 50 minutes. While whole mount staining remains the best way to analyze cells in their 3D entirety, with optimal preservation of tissue, it can be time-consuming as it can take weeks or months. When compared, excellent preparation time is significantly shorter, for instance 11 minutes versus 38 minutes for processing 16 samples. Colloidal method also reduce preparation time by around 10 minutes only. Other time-related challenges include longer sectioning time for FFPE blocks, difficulty distinguishing cellular material from the matrix in unstained section, and the need for additional H&E levels to confirm adequate cellularity. Lastly, while histogel is marketed as a cost-effective method, its overall cost can be higher and limited availability depending on workflow, sample volume, and downstream processing requirement. For histogel application, particularly those involving whole mount staining, are low throughput, time-intensive, and require large volume of reagent and antibodies.
Now, I will be expanding on how to overcome or minimize the limitation of histogel, starting from low cellular yield, which can be overcome through double centrifugation. You can refer the table above, which the first spin requires lower speed but longer period to concentrate the cells, while the second spin requires higher speed but shorter period for further compact the cell. You can refer the picture at the left side. It shows the difference between single and double centrifugation, in which the double centrifugation shows more compact cell palette. Let's moving on to how to overcome standard histogel that has weak cell cohesion. This can be fixed through cell palette pretreatment with 95% ethanol. Now, you must be wondering how 95% ethanol can strengthen cell cohesion. Well, this is because 95% ethanol can cause protein precipitation, especially in the cell membrane. This will reduce membrane fluidity, enhancing cells aggregation, as you can refer picture at the left side, from monolayer cells to 3D aggregates. The 95% ethanol can also enhance nuclear details and rapidly fix the cells. The procedure is as below, in which 95% ethanol is added to the cell palette after centrifugation, followed by fixed action about 5 to 10 minutes, centrifugation and discard the supernatant. Then we can proceed to the histogel. Moving on to the third limitation of histogel, which is uneven cell distribution within the histogel. This can be fixed through the use of base molds, as you can refer picture A at the left side, in which conical tube can only localize cells at a single point, causing cells overlapping. Instead of using conical tube, we can replace it with base molds, as you can refer picture B at the right side, which the base molds can horizontally spread the cells for more even cell distribution. Now, I want you to look at cell block A. This is a histogel cell block. Can you spot the cell palette in the embedded histogel? No? Exactly. Turns out it is difficult to locate cell palette when histogel is being embedded in the paraffin wax due to its clear feature. Thus, to overcome this, we can use a short fragment about 3 to 5 mm of dark surgical suture or threads to be added to histogel as a marker for cell palette location. As you can refer cell block B, this is an embedded histogel with surgical suture. Now you can locate your cell palette easily.
For the conclusion, I will summarize the key points of histogel cell block method. Firstly, in terms of the method, this method is an effective technique for preparing cytology specimens. It allows loose cells from liquid samples to be converted into a solid tissue-like block that can be processed using routine histopathology procedures. Next, it is important as it improves morphological assessment and also supports ancillary studies such as immunohistochemistry. When compared to other cell block methods, histogel offers good reproducibility and compatible with routine histology workflows. Although histogel may be less effective in samples with low cellularity, it remains a valuable tool in diagnostic cytopathology. In conclusion, the histogel cell block method is a reliable and practical approach for cytology specimen preparation. Thank you.